And I started working in wilderness actually back in 2006 as a field instructor. And I worked with young adults quite a bit during that period of time. And then I was a therapist starting in 2010. And I worked at the Entrada branch for about 4 years, from 2010 until 2014, working with young adults. And then I've been working at Cascades for the last 2 years, also working with young adults. So in working with young adults, something that unfortunately we see at times is this refusing to do treatment, which, as you can imagine, is a little bit more tricky in the sense of they are technically an adult, they're over 18, and so they can refuse treatment. We can't force them to be here. We can't force them to do our program. So what do we do in those situations? So that's really what this webinar is going to focus on and address today. So my guess is that if you are watching this webinar, it's because you have a young adult in our program, either at Cascades or Entrada, and you're trying to work through maybe this hurdle of them saying, Mom and Dad, I don't want to be here, I'm coming home, or I'm leaving, or whatever that might look like in their process. So I really want to kind of go through step by step what that process looks like, how we address it on our end, the way in which we invite you to address it on your end as the parents, and go from there. So really the first thing I want to talk about is how you might be feeling. I think as a parent, it's really, first of all, just getting your son or daughter into treatment to start with is overwhelming, exhausting. It can be quite a process. And then to finally have them land here, and then to be almost kind of going through that process again with them refusing to be here, not wanting to be here, it can be really hard. So I just want to validate that experience. You know, you might be feeling anxious, scared, overwhelmed, angry, kind of at a loss, that powerless feeling of I can't force you to do it. I know that you need this. It's very evident. You can lay out all the facts and all the evidence. And typically, if your son or daughter is wanting to leave, it's not logical. This is an emotional decision. This is an impulsive decision. This is a reactive decision. And so it's hard to reason with somebody who's not in a logical headspace. And that's just really hard as a parent. And it's scary to know that if they leave, they could be going right back into the same patterns and behaviors and what have you. And we know that on our end, obviously. So let's see. Really, what I want to talk about is when a client's coming into a wilderness program, oftentimes they're in the very beginning steps of their change, their process towards change, their process towards growth. And so something we talk about here is this concept of the stages of change. And there's a variety of stages, starting with pre-contemplation. Pre-contemplation moves into contemplation, and so on and so forth. But really the first step is pre-contemplation. And what this essentially means, it looks like it's typically the point where the person isn't even aware or fully aware that they need to make change. There could be a lot of denial, kind of pushing back, saying this isn't, really kind of minimizing how big of an issue something might be, and not wanting to look at really what's going on for them. I think oftentimes what this looks like in a wilderness setting, what I describe to parents quite often is wilderness it just slows everything down. There's no technology, they can't get on their phone, they can't you can't watch a TV show, they can't hide behind a computer game. Like there's just no access to any of that. So everything slows down and they have to actually sit with themselves, probably for the first time in a long time, and feel their emotions. And that can be terrifying. And even if they're not fully aware that that's what's going on for them, I see that so often that there's this moment of almost panic. Like I have to get out of here as fast as possible, because if I don't, I actually have to feel whatever it is, my anger, my sadness, my shame, my guilt, my whatever it might be for that individual. And so there's that desire to run away from that as fast as possible. And for a young adult who has that power of, hey, I'm 18, I can leave if I want to, that's oftentimes what it looks like. And I think part of that is also what I point out in the last bullet point of this need for control. I'm 18, so I can make my own choices, or I'm 20 or however old, and you can't tell me what to do, mom and dad or my therapist or whomever it is. And so there's this real kind of pushback and kind of fighting for the sense of control. And I guess what I want to emphasize is oftentimes, this can be a very normal part of the process. I mean, the fact that we have a webinar on it speaks to that your son or daughter is not the first person to want to leave treatment. This often can be a first step before they commit, before they engage. And so I guess the next question really would be like, well, how do we work with this? How do we support a young adult who is saying they want to leave, who is saying they don't want to commit, who is saying this isn't really a problem? So let's look at that. The first piece is, just kind of looking at how to respond. And what I really talk about with parents and even with the client is to trust the process, that this is a part of the process, to not panic, and to let the program kind of first do its job. And that looks like myself as the therapist, whichever therapist you're working with, the staff members who are in the group, and really the peers play a huge role in this process. So typically the young adult is talking about wanting to leave and why they want to leave and what have you. And we'll oftentimes start by having them talk to their therapist and really talk through it. I personally take a very nonchalant approach to this conversation because I find the more I push and the more I challenge, the more they have something to push against. So I just take an approach of like, yeah, you are an adult. You could leave. Let's talk about why you want to leave. If you do leave, what would that actually look like? And allowing them some space to feel like they have a voice and to feel somewhat empowered and feel like it is an option sometimes can diffuse the situation just right there. And sometimes they really have to see it through even more. And so the next line of defense would be to have the group talk to them. And the beauty of the way Evoke works is it's a rolling admission. So there's typically people in the group who've been here for quite a while, some people who've been here for a medium amount of time, and then like your son or daughter can be fairly new. And because of that, there's people who have also maybe gone through these steps of wanting to leave, or maybe I've even had times where a client's wanting to leave and somebody who's been in the program for longer, maybe somebody who's been here for more like 8-9 weeks says, oh, I was in your shoes. I actually tried to leave. I actually went through that whole process and then finally decided to say, and I'm so glad I did, and this is why, and this is what I'm getting out of this program. And so they're in real time hearing from their peers a similar experience, and also the further experience of like deciding to stay, deciding to work through it, and having success. And they see it. It's very visible that the clients who've been here longer are having success, are making strides, are feeling more confident, are feeling empowered, are having some real benefits. And that can be a really powerful part of the process. And oftentimes these clients can and will be more blunt, like, hey, you really shouldn't leave. That's a bad idea. Or I'm really scared for you if you leave because I think you're going to go right back to that unhealthy relationship or using drugs or staying in bed all day because of your depression or whatever the issue might be. That you have your peers really pushing against you. So I think that's a big part of the process, and that's happening pretty consistently. Typically, staff will call a formal group where the whole group will have a discussion where these peers are giving the feedback. So there's that piece. And then there's just the day-to-day conversations, like around the dinner. They'll be having dinner, and around the meal, this will be a topic that comes up, and they'll hear some of this feedback, or they'll just witness the change and growth in other people. So that's certainly a part of the process. In addition, what we really encourage is just to slow everything down, that we're not making an impulsive decision. Just because a client's saying, I want to leave, we're not saying, okay, put on your backpack, we're leaving right now. We oftentimes say, okay, well, we have to make a plan. We have to get enough staff out here to support you in leaving. And what I mean by this, to break it down even further, is we don't give an adult a ride out of the field. Unless the parents are saying, okay, we don't think it's a fit too, but I don't think that's what this webinar is about. This is typically parents saying, we want you to be here. We know you need to be here. We're committed to being here, so that if the young adult is choosing to leave, they're choosing to leave without the support of their support system and without the support of the program. So we're not going to just come pick them up. And this is part of the intervention. This is part of slowing it down, that they actually have to hike out of the field area. And so For some clients, that's a deterrent right away. I've worked with many young adults who are like, I have to walk? Oh, forget it. That's too much work. I'm not interested. And then I've worked with young adults who are up for the challenge. They're like, okay, let's grab my backpack. Let's hike out of here. How many miles am I looking at? And it can be, it depends on where we are in the field area, but it can be, 20 miles at times. And again, that's totally completely dependent. And we typically don't even tell them how long it is. We just say, oftentimes I say, well, it took me an hour and a half to get here by car. So my guess is it'll take you a long time to hike. I kind of keep it very vague like that, and staff do a similar piece. And usually the other peers are they either are in the dark or they're respectful enough about not sharing that information. So that's part of the process of slowing it down. And we typically say we need to get staff out here. That might take a couple of days. It's not going to happen immediately. Why don't you first talk through this? And then there's a few steps we go through. I'll talk about this in another slide, in terms of letter writing, phone calls, ways to respond and have you guys support the process of staying in the program before we're even in the walking phase. We also give them a packet, and I'll talk about that in a moment too. The only other piece I want to talk about on this slide is this idea of not panicking. I often coach parents to not jump on the roller coaster, right? Typically, if a client's wanting to leave the field, it's because they're on their own emotional roller coaster. They're feeling their own sense of anxiety, overwhelm, shame, maybe looking down the tunnel, feeling like the treatment's going to be too much or too long or too scary because it's going to bring up a lot of stuff they don't want to look at, right? There's all these emotions going on, and it's really normal and it's really valid. And I think what I really want to encourage you as the parents to do is to not jump on that same emotional roller coaster. Let it be their struggle. Let them go through it. And obviously it's going to bring up your own stuff and fear and all that panic, but I really encourage you to look at your own emotions around it and differentiate and let them have theirs while you're having yours, if that makes sense. And so I think the more you're able to do that, the more you're able to respond versus react. And again, on my next slide, I'll go into this in a little more detail. Just to draw attention for a moment to the bottom of the slide, I really like this little drawing because I think it's just so relevant. Is that I think, especially as parents, we kind of have this idea or this plan that everything's just going to be this. You're going to go into treatment and you're just going to get better and be on the straight and narrow. And of course, wouldn't that be nice? And in reality, it's up and down and around, and twisty and windy, and it's going to continue to be that. And that's just real life. That's just really how things look. So it's just a reminder, I suppose. So this is kind of what it looks like in terms of what we're inviting you to do as parents. And before I even get there, I want to include, I think I meant to include this slide, and I'm not seeing it here. There is, before we even get to the point of letter writing, there's one other intervention we use in the field. We call it the adult walker packet. And again, I mentioned that we have them hike out of the field or walk out of the field. So they become like, we call it, they're a walker. And so this packet that they would get is a pretty detailed packet, asking quite a bit of questions about their plan and the logistical part of their plan and the emotional part of their plan. And then we give them a lot of information, like if you want to get an apartment, it's probably going to cost, it's like in Bend, it would probably cost about this much money. Food costs about this much money a week. And like really kind of giving them a sense of what real life would look like without parent support. So for example, if you as a parent were going to set a really firm boundary around, okay, you can leave the program, but we're not going to financially support you leaving the program because we think you need treatment. So that would look like if you're going to leave the program, you have to figure it out on your own. And so that's kind of this idea of this packet is like really putting it in perspective and giving them that bigger picture of like, so what does it look like to live in an apartment and survive on your own without mom and dad funding it? And again, just another way to slow down the process, another way to get them thinking. And the idea of moving from that really emotional, reactive thought process to a little bit more rational of a thought process. So then the next step would be we would first of all encourage your son or daughter to write you a letter saying, I want to leave the program. And then the next step would be obviously responding. And gosh, a couple of different things. So I really want to empathize or have you emphasize that I want you to empathize with their process. So I think it's okay to say, gosh, it sounds like it's really hard out there. And typically the two letters I see written home from an adult client who wants to leave the program, I see two things. I see either, first of all, a lot of manipulation, like wanting to really tug on your heartstrings, make you feel really, really bad, tell you how horrible everything is, and really go to that extreme. Like it's so, so cold and the food is miserable and, the group doesn't like me or whatever they might say to just make you feel they're going to find a way to tug on your heartstrings. One of my favorite stories was I had a young woman writing a letter and said, it's so cold, my pen's barely, and then she didn't even finish the statement, kind of giving the impression like it's so cold, my pen's not even working anymore. I thought it was pretty creative and clever. I was out there, my pen was working fine. I don't think hers probably would be any different. But again, they're just going to really tug on your heartstrings. So I typically see that letter, or I see the letter of, I came out here and I saw the light and everything is better and I figured it out and I'm ready to come home because I'm better after 3 days of being here or a week of being here. So if you've gotten either of these two letters, I want to say that's very normal. And I encourage you in a few weeks from now, once your son or daughter has settled in and bought into the process, to compare the two letters, and it will make you laugh because 3 weeks from now they'll be saying, oh, the food's not that bad, and oh, I really like this person in my group, and oh, this staff member is amazing, and there's just this real shift that takes place, which I think emphasizes some of that manipulation. One thing you could take a look at and ask your therapist to send you is the top 10 ways children manipulate their parents. I think it's really helpful. Kind of, you'll see they're like, oh yeah, they are bargaining. Yes, they are, whatever those manipulation skills they tend to use. It kind of lays that out and gives it some perspective. So just a side note there. So going back to my first bullet point. When you do get this letter, I think the first thing you can do is really listen to their experience, recognize that there's some manipulation, but also acknowledge that this is their experience and validate their experience. And no part in that listen, acknowledge, validate doesn't say agree. So even though you're saying like, wow, that does sound really hard, and I'm sorry that you're having such a hard time, or I'm sorry that it's so hot out there or cold out there, or whatever it might be, again, you're not changing your boundary, you're not agreeing, you're just validating their experience. And again, I think that sometimes can diffuse the process. I do this all the time as a therapist. I think it's really important because it's that person's experience. And then the second step in the letter would be to share your thoughts. So you might say, gosh, it sounds like it's been a really hard transition. I hear that you feel really angry that you're in a wilderness program, that you're really missing your friends, that you'd rather be home, that you don't like the food out there, you don't like the clothes, whatever it might be. You're really kind of just reflecting their experience and honoring their experience. And then you're also being honest with, yes, and as your parents, we really believe that this is the right place for you. We did a lot of research. We talked to a lot of people. We got recommendations from people we trust. We really hope you make the decision to stick it out, to give it another try, to give it a few more days, to give it another week, to give it some time to work through it. And I use some of that language really specifically where I said, we hope you, because you can't make them do anything, especially as an adult. And so it's a hope, it's an intention, and that's how I would frame it. And then the next step is setting a boundary. And again, you're not telling them what to do or what not to do. You're simply saying what you are willing or not willing to do. And at this point, what I really encourage is to set a pretty strong boundary. If there's two parents in the picture or multiple parents in the picture, I think it's really important that there has to be a united front. If there's somebody in the system who is not committed to the program, the client will find that loophole and use that, and the boundary is not going to stick. So it's going to be really important to be united front. And oftentimes I even say to write the letter together or write very similar letters. So it's very clear that you're on the same page. And at that point, you're saying, if you choose to leave, we can't financially support you in doing that. Again, you're supporting them in spirit. You're still going to love them. That's unconditional. But typically I tell parents, like, they're not allowed back in your house because they haven't done the work, they haven't done the treatment to go back and live in your house in a way that is safe and productive. And so you're really not doing them any sort of service by letting them come back and live in the basement and play video games or smoke pot every day or whatever it might look like. And so oftentimes that, just knowing that parents aren't going to support them leaving, that again, that can be a stopping point. Not for every client. Some clients still want to push. Some clients say, okay, I have a friend who will support me, or an aunt or an uncle. And so you might want to talk to those people and get them on the same page and make it clear that that's not the case. Sometimes that's out of your control. And that's something to talk to your therapist about. But that's a really important piece, that you're setting a boundary, that you're saying, this is what we can and can't do. And then you can say, like, we love you too much to allow you to continue going down the path you've been going down. We love you so much that we're willing to continue to hold the boundary of you being in wilderness with the hope that this can be a really positive experience for you and you can turn your life around. Like, that's some of the language you can use in your letter. And typically I would say working with your therapist around this letter is really important, sending a rough draft, getting feedback, and kind of going through that process before sending it out to the field. The next step in the letter, I think you can say, like, this is our boundary, but what's your plan? What are you thinking? This is what we're willing and not willing to do. What's your thought? And again, putting the ownership on them. This isn't yours to figure out. This is theirs to figure out. You've said, I'm not gonna pay for a plane ticket for you to come home. You're not allowed to live at home anymore. Maybe if they were living independently, we're not going to help pay for your utilities, your apartment, or whatever you were doing to support. Then you're really putting it on them. Things to avoid. I think I really encourage to avoid kind of moving into lecture mode. I don't think that's going to be helpful. They probably heard it before. They probably know. If anything, let the peers lecture, because that's what's going to happen. There are going to be peers in the group who are farther along, and they're going to give them the, what are you thinking, man? That's a terrible idea. Let me give you my thoughts. Again, I mentioned this already. Be cautious about not jumping onto their emotional roller coaster. And another piece I think is really important is not using shame or guilt to keep them here. Again, all you're doing is setting a boundary, and telling them you love them, telling them you want them to get the support and help they need, but you're not going into, you've hurt the family, how dare you think you can come home because you've hurt the family so much, or things to make them feel bad, because the research really shows that typically people who are in treatment already feel an immense amount of shame and guilt, and we don't need to pile it on. It's easy to do that sometimes, but it's also ultimately not helpful. If that's what made people better, they probably wouldn't need treatment because they're doing that to themselves already. And the last piece is just to avoid rescuing. And that part I think is also really hard as parents. It's scary to imagine setting these boundaries because there's a what if. There's the, okay, if I set this boundary and I say you can't come home and I'm not going to give you money, what if? What if they still leave? What if they still walk and get back to our office? What then? And that's a really scary piece. And that's typically the point where I see parents want to jump in and rescue. And that's typically why clients push and push and push, because they almost want to call your bluff. And they at some point, mom and dad are going to cave. At some point, they're not going to want me to be doing this all on my own. And so I think just being cautious about that. So let's talk about that a little bit more. What does that look like? So how we handle it as a program, like I said, the first step is walking. Some clients don't even ever make it to the point of walking, and many do. And walking looks like being with typically at least one staff, and oftentimes two staff members who are walking them out of the program. So it's very safe. They have their backpack, staff have their backpack. They're just like how they would be if they were in the group. They're backpacking, except they're heading in a very specific direction. We don't give them a lot of information about what direction to go, but typically clients who are wanting to leave are paying a lot of attention. So they have a general sense, and we are very much definitely keeping them safe. while slowing down the process, while continuing to talk to them about, are you sure you want to be doing this? We can turn around at any point. Really, there's no point where we can't turn around. And there is a certain point, though, that we do end the walk or end the hike, and we do come and pick them up. And that's typically when they get to a point in our field area where it's more trafficked, where we see more campers, where we see more truck drivers, things like that. What we really want to avoid is, a hitchhiking situation. We'd rather our people pick up our clients and be very intentional. Again, we just are really focused on safety. So at that point, we might pick up the client. But typically before we're doing that, if we've already done letter writing and they still decided to walk and they're in either right before they walk or during the walk, we'll typically, if you are open to it, probably do a phone call. And so they'll actually call you from the field area, oftentimes on a satellite phone, and talk through some of this. And my guess is you'll hear very similar things to what you heard in the letter, like, I don't want to be here, this sucks, I hate it, this is what I don't like about it, it's manipulation, come on, mom and dad, bring me home. And so I think it's really important in preparation for the phone call to feel as prepared as possible, to feel really strong. We typically time limit the phone call so it doesn't just become really circular and get stuck in some of that loop. And so, we might say, like, you have 20 minutes to talk to your parents or 30 minutes to talk to your parents, and a certain point where the staff know to say, okay, you kind of hit your time limit. And that's a way to support you in a lot of ways. So it's not just feeling like you're getting bombarded. You can also set that boundary. You can also say, okay, we said our piece, like say your son's name is Tommy. Okay, Tommy, we said where we stand. You're not welcome to come into our home until you've done treatment. We're not going to pay for you to come home. This is kind of your option at this point. We're not talking about other options. We've kind of said all we can say. We hope you can keep talking to your staff members or the group about it, and we're gonna hang up now. That's always appropriate and okay to do. Sometimes the therapist the staff member is always listening in. So if a client is talking on the phone, there's always a staff member sitting right next to them. They typically can hear at least one side of the conversation, and oftentimes both sides. Just because there's that kind of, on the sat phone, you kind of hear both sides of the conversation. I think sometimes a therapist might be on the phone call with you, helping to facilitate it, and sometimes that can be really appropriate. I often sometimes don't do that, and that's also very intentional because there can be this sense of like you're just saying what the therapist told you to say. And so sometimes if the therapist can kind of back out of it, then it really sends a clear message that these words are coming directly from you and not just from the program or not just from me. And there can be less of that sense of being gained up upon. So again, that just depends client to client and therapist to therapist, and that's something that will be worked on and discussed and be very intentional. So again, the phone call can really change things for clients. I've seen that often of like, okay, I wrote this letter, got this letter back from mom and dad, it pissed me off, I still want to leave. They get on the phone and have to see how serious you are. And at that point, they change their mind. I've had cases where I've had to do several phone calls. And so that can happen sometimes is they have a phone call, they don't buy it. Another day goes by, they hike a little bit more, or they're still in the group, depending on the scenario. And then they want to have another phone call to ask them their question or and again, we don't want to give them phone calls constantly. We want them to be fairly present. We want them to work this through with the program. But there can be times where it makes sense to do more than one phone call. So again, just working with your therapist on that. So, again, if they get to the point where they've hiked far enough where we feel like it's important and appropriate to pick them up, we will. And at that point, we'll bring them back to our office in town. And even then, we're slowing down the process. We're still talking about it, thinking it through. Typically, before they get to the office, we have some conversations with you around what they might have at the office. Do they have a wallet? Do they have a cell phone? Money? What do they have that would a computer help them move in maybe an unhealthy direction? And at this point, we can make some choices because oftentimes our adult clients, their parents are still paying for their cell phone, for example, or some of the credit cards might be linked to parents' accounts and not their own personal money. So that might be a great option to say, hey, we give permission to send the cell phone back to our home, to send us their wallet, to we're going to cancel these credit cards. Again, we're just kind of making their limits really, we're limiting their options, I guess is what I'm trying to say. And that's really appropriate because again, it's like, hey, I paid for your cell phone, and if I'm not going to support you in this decision, I'm not going to continue to pay for your cell phone or for you to have this credit card or whatever it might be. And that's something we would actually let them know in this decision-making process as well. So oftentimes by the time they get back to our office, again, they have limited resources on every level. Depending what time they get to our office, we might, it might be appropriate that they spend the night here. We also talk about going to a homeless shelter, both in St. George and in Bend. We have homeless shelters very accessible to us where we can have them, and they're familiar with us because this happened before, where some clients get all the way to the point where they will check themselves into the homeless shelter because those options are so limited at that point, because parents are really holding boundary. And that can be a huge wake-up call to get to the office and realize that you still are not changing your mind, that you still are holding firm, if their options are incredibly limited. Oftentimes that's very much a turnaround point. And so for some clients, they go so far as to spend a night or two at the homeless shelter before realizing, like, what am I doing? What am I thinking? And at that point, they have access to you, they have access to us, they have our phone number, they know where our office is, and they can come back. And I have had that happen more than once, where a client has gotten all the way to the homeless shelter, spent a couple nights there, had the wake-up call of like, oh my gosh, no one's going to rescue me. I have to do this. And then they come back. And that can be a pretty powerful experience because at that point they're choosing it. I'm trying to think if I missed any pieces. My last slide here is a poem that you can take a moment to read. It's called A Story in 5 Short Chapters. It's a poem that clients in the field are being exposed to often. It's often in conjunction with this whole idea of the stages of change that we talk about, and we really go through all the different stages. That's a webinar, Stages of Change, that you can watch. And in that webinar and in the field, we talk about how, there's just multiple levels of the stages of change. And this poem specifically, I think, highlights this fact that it takes a while to get there, that we walk down the same street many, many times and fall in the same hole many, many times before we finally walk down a different street entirely. And that's exactly what's happening with your young adult when they want to leave the program. They are afraid. They don't even know how to walk down another street. All they know how to do is fall down that same hole. And so I know I've been emphasizing this the whole program or the whole webinar, but really your role is to set the boundary to say, hey, we love you too much to go walk down that same street and fall down that same hole. And so we're going to set some boundaries out of love, because we really want to encourage you to learn the skills and the tools and to do that deeper work so that you can get to the point of walking down a different street. So I'm going to stop there. If there's any questions, now would be the time to throw them out. I'll take a moment just to pause and wait to see if there's any specific questions to answer. And if not, we'll wrap up. So a question that just popped up was whether or not a client, like more than one client, has ever walked together. The answer is yes. I've had that happen in my group, where I've never had more than 2. That's just my group. My guess is there's been more than 2 in other groups. But I've often seen, they kind of buddy up together and they say, oh, you're going to walk, well, I'll walk with you. And there's that kind of sense of camaraderie and support they get from that. And that can be a challenge. But again, we've worked with it, and the example I'm thinking about, well, to be really candid, in the example I'm thinking about, one set of parents held the boundary really firmly and one set of parents did not. And so one client came back to the field and the other did not, is what happened. Did that answer your question, or was there more to that question or another question? I'm just taking a moment to pause, see if there's anything else. Okay, it seems like there's no more questions. So we will wrap up there. Thank you so much for joining this webinar, and hopefully this was helpful. And I think after watching this, I just really encourage you to talk through this again with your specific therapist. because they will probably have some really specific direct feedback based on your individualized situation and your son or daughter, and what will be the most impactful and effective for your family. So thanks so much.